Hey, it's Noah. Today I'm going to be showing you what I keep inside my everyday carry med kit. Now, what I keep in here is pretty similar to the med kit I have in my Get Home bag, which I made a video about in the last few weeks, and I'll link to that in the description and in the cards if you want to check that out. But let's dive straight in. The bag is pretty simple with just one main pouch and some MOLLE straps here on the front. On the back, it has the ability to be strapped onto a backpack, and there's a huge Velcro sheet right here, so that if you really need to quickly deploy it, you could leave this attached to the bag and pull the med kit right off. Now, I don't really use this functionality, but it is there. But let's hop inside. Nice zippers on each side. And when it opens up, it folds into this nice kind of three-piece layout, all still attached. So front and center, we have some important trauma stuff. We have a tourniquet right here. This is one of the Velcro varieties, which I think is a little bit easier to get on. Of course, very important for stopping massive bleeding. And then right up next to it, we have a compression bandage or a trauma bandage. And basically that allows you to put a gauze pad that's in here on a wound and then wrap elastic around it and then pull it back on itself, which will put pressure right on a wound. Get to those later. We have a Sharpie in here, so you could write the time on your tourniquet when you applied it. Also easily accessible are some trauma shears for cutting bandages or someone's clothing off of them if you had to get access to a wound, or maybe cut a seatbelt, that type of stuff. Tucked back in here, we have some compressed Z-fold gauze. That is gauze that instead of being in a roll, like gauze often is, it's kind of in a stack. So that means that you could open this up and then easily pack it into a wound if you had to. And it's all vacuum sealed to be in a nice, tight, compressed package. Going back into the pouch back here, I have some Quick Clot, which is basically just gauze impregnated with a chemical that makes blood clot faster. And then I also have a pair of chest seals to deal with wounds that have punctured the chest cavity. Hopefully I'd never need to use that, but better safe than sorry. Right here we have just an emergency blanket for dealing with hypothermia or more commonly shock. Basically it just can help keep you warm and insulated. That is kind of the main trauma section. So I'm going to clear some of this off to the side. All right, moving on, we'll take a look up here. There's just a bag with I think 2 pairs of gloves in it. I suppose I could go with the trauma stuff, but in general, you might want to have some gloves on hand if things get a little messy. I won't necessarily take them, or I'll take one off. But right here, I have 2 safety pins that I think most commonly would be used to maybe secure a bandage or a sling or something like that. But you could also maybe sterilize it and use it to help get a splinter out or what have you. Right here that I set aside earlier, but that is kind of kept in the main pouch area, I have a roll of athletic tape and a roll of kind of this Coban bandage, both to be used for securing gauze or a bandage or dealing with a sprain or something like that. The rolls are a bit bulky, and maybe I could compress them down further. And I don't love that they're just loose in this section, then they could just kind of fall out when I open it. But for this kind of style of bag, it's really the only place they would go, and I like having at least one of them on hand, but both are nice. Getting in here, this front pouch, there's 2 pouches right here, and in this front one I just have kind of a boo-boo bag that, well, I suppose it can do a little bit more than that. The main thing it has in it is just a lot of assorted Band-Aids, or like some of these Next Care ones that are seal on all sides and are more waterproof. So just some littler ones. I also have some, not steri strips, but butterfly bandages in here that could be used instead of sutures or stitches. Not as strong, but could help if a wound is more open and you needed to close it. Basically, they're sticky on each end and just allow you to stick on one side, pull over, and stick to the other side. More Band-Aids. There's a couple small little just gauze squares in here. Some bigger Band-Aids. Some bigger non-stick pads, which I should actually move. I'll show you in a second. Some alcohol pads. another big Band-Aid, and then just a big thing of moleskin for dealing with blisters. Let's move this all off to the side. All right, moving into this back pouch here, the little Velcro flap. Let's see if I can get these out easily. I have an assortment of large gauze pads, so a little larger than was in that other bag. A couple like 3 and 4 inches, and then a few real big ones, another smaller one. But you know, just non-stick gauze pads for covering a wound. And then finally, we're getting to the end here. We have this little pouch, which is attached, but it's just nice for keeping things separate. Oop. And everything in this pouch is just kept in the same Ziploc bag, just for kind of organizational sake. Now, I'll get to this last, but before I do, I have an itch relief stick, because we have mosquitoes where I live, and their bites really affect me, and they itch and suck. So I keep an itch stick with me, or a Benadryl, whatever. It has Benadryl, itch relief stuff in it. Basically, get a mosquito bite, just put it on there, and it stops itching, and that's glorious. And then I also have 2 little tools in here. I have a nail clippers, and I have tweezers. I think both are super useful to have, especially the tweezers. I suppose you could accomplish the tasks that these do using a knife, but you're not gonna be as precise. It might get a little messier and be less effective. This is where I keep some medication. Now this little setup is actually the same as what I have in my bug out bag, but we'll get into it in a second. I'm just gonna quick take some things out because I have some prescription medication in here because I take prescription pills. And so I have a couple days worth just in case I forget to take it one morning or something like that. But I don't necessarily need to show the internet that. But I will move into the rest of it. So on the top, I actually have some water purification tablets, just in case I was ever in a situation where I didn't have access to clean drinking water. That's a pretty important thing for your health, whether that's to like wash a wound or just treat dehydration. On the note of dehydration, I have some anti-diarrheal pills. That's a bummer in normal life, but if you were ever in a situation where you didn't have access to enough water, diarrhea could cause dehydration and could be fatal. Also in the digestion area, I have some antacid tablets. I have some antihistamine Benadryl tablets for allergic reactions, whether that's like itch, poison ivy, or more of an internal allergic reaction. I have melatonin, which is a sleeping pill. I have Dramamine, which is for motion sickness. And then I have ibuprofen, which is a painkiller. And I also am going to, like the one in my bug out bag, I need to update this and add maybe some aspirin and acetaminophen painkiller as well. All right, and then to pack it away, I just put that like that. And it's a little bit of a faff, but I deal with it. Put the pouch over like that, fold it shut. So it is a little bit of a pain in the butt sometimes to close it, but I'll spend 15 seconds closing it to put those little Coban rules in there. One other thing that I wanted to note is that I could put the tourniquet on the outside with a rubber band like so, for easier access. Because I think some in the comments might suggest that. But how I put this in my bag, this bulkiness doesn't really work, but I just wanted to note that that is something that you can do and that's something that I'm aware of, but that doesn't really work for me. Alright, that has been me walking through my everyday carry med kit. Thank you for making it to the end of the video. If you have any suggestions for how I can improve this, what I should put in it, or what you learned, anything, I'd really love to hear about it down in the comment section. Also, again, I did another video with a very similar med kit that was my kind of bug out get home bag, and I'll link to that in the description if you want to check that video out. But anyways, thank you so much. If you enjoyed the video, please make sure to hit the like button and subscribe for more. I do all sorts of stuff on this channel, preparedness, bushcraft, biology type stuff. But I hope you have a great rest of your day, and thank you once again for watching. Bye.